Hi, Heather the Hygienist again with Simply Silver Mouthwash. And if you haven't already checked out my previous video on what is gum disease, I hope you do so. The next thing we're going to talk about is brushing. The first thing you always want to do is use a soft or an extra soft toothbrush. It is not how hard you scrub your teeth. Most people, they get a toothbrush in their hand and they scrub the heck out of their teeth. That really causes recession of your gums, which can lead to sensitivity, which I know a lot of people deal with. So definitely avoid long strokes back and forth. I highly recommend an electric toothbrush. My two favorite are the Sonicare and the Oral-B Braun, but if that doesn't fit into your budget, even a battery operated one would still do better. I am going to show you how to do what's called the modified Bass technique of brushing. So on my little guy here, we're just going to take the bristles of my soft toothbrush and I'm going to point them down into the gum at a 45-degree angle. The angle is so important because plaque forms right down here at your gum line. So most people, they just get in there and they just kind of scrub real quick, 30 seconds, and they think they've done it. But what you need to do is disrupt the plaque that's forming all along that gum. So you got to take the bristles, point them 45-degree angle. You'll know that you have the right angle when you feel those bristles go into your gum tissue. And if you were doing the modified Bass technique, it's just small little circles, 5 to 10 seconds, real slow, couple of teeth at a time, all the way around. Now if you're using an electric toothbrush, you still want to keep the angle, and then you can even sweep up, just like that. You're going to do the same thing along the inside, which is your tongue side here. Again, 45-degree angle right into the gum, all the way around. Now on the tops of the teeth, you have what's called pits and fissures. So you want to make sure that you keep these areas clean because this is where cavities can form, is not only on the chewing surface, but in between the teeth here. People get many cavities in between the teeth from not flossing. So what you want to do to keep the tops of the teeth clean is you just want to make sure that you're scrubbing the top. That's okay. The only place in your mouth where I'm going to say scrub away would be on the tops of the teeth. Now, from the eye tooth to the eye tooth, which is your canine to your canine, you're going to hold the toothbrush straight up and down. And then you would just do tiny little motions here all the way around. And again, if you're using an electric toothbrush, you would just hold it in place all the way around. Now for the top teeth, it's the same concept. You're going to angle, push the bristles, 45-degree angle up into the gum, and then you would do tiny little circular motions all the way around. You would do the same thing on the inside. Brush really hard on the tops of the teeth to keep those pits and fissures clean. And then from the eye tooth to the eye tooth again, hold the toothbrush straight up and down, and you would just use small little motions like that. Now, a lot of people ask me what toothpaste I recommend. I would urge you to get your toothpaste box and look at the back of it. It says, do not swallow harmful contact poison control. I do not recommend you use anything commercial that contains fluoride. I know I'm totally going against the grain when I say that, but I encourage all of my patients to be your own health advocate. Please don't take my word for it. Go and do your own research on fluoride and what it really is. So be a label reader. Look at your labels. I would highly encourage you to use something natural and organic like Simply Silver. You can use this as a toothpaste. You would just put a little bit into your cap. You would take your toothbrush, dip it in, and you would apply it as toothpaste. You can do that. You can also use anything natural, whatever you prefer. Some people, really like to have a flavored toothpaste, but you do need to be careful because what makes the foaming action is something called sodium lauryl sulfate. And many patients that I have deal with canker sores, and that can really cause canker sores is that sodium lauryl sulfate. So like I said, read your label and make sure that you don't use any toothpaste that has that in there. And if you want to find out how to properly floss your teeth, watch the next video.